For this injection, the following armamentarium will be needed: a yellow cassette with a mouth mirror and cotton pliers, a needle capper, a syringe, 2x2 cotton gauze, 25 gauge long selection, a cartridge with solution appropriate for the patient with or without epinephrine, 20% benzocaine topical anesthetic, and optional Q-tips. Before administering this block, the cartridge must be loaded with the top portion in first. Be sure that the barcode is pointed away from the large window and the clinician is able to clearly read the information printed on the cartridge through the large window. Provide one strong twist of the syringe so that the harpoon is engaged, and never pop the harpoon with the palm of your hand. Check that the harpoon is engaged by carefully pulling back slightly on the thumb ring. Carefully twist off the bottom portion of the needle and attach it to the head of the syringe. Twist the needle into place until snug. Be aware of bevel placement for your specific injection. The nerves anesthetized will be the infraorbital, the inferior palpebral, the anterior superior alveolar, the middle superior alveolar, the lateral nasal, and the superior labial nerve. The areas anesthetized will be the maxillary anterior teeth and premolars, the mesial buccal root of the maxillary first molar in 28% of the population, the facial periodontium and gingiva of the anesthetized teeth, the upper lip to the midline, the medial part of the cheek, the lower eyelid, and the side of the nose. For the IO, the extraoral landmarks will be the infraorbital notch, ridge, depression, and foramen. The intraoral landmarks will be the maxillary first premolar and the maxillary mucobuccal fold. At this point, apply the 20% benzocaine topical anesthetic to your insertion point. To locate proper hand placement for the IO, the infraorbital notch is located between the pupil of the eye and the labial commissure. For this injection, we will be using a 25 gauge long selection and administering 0.9 to 1.2 milliliters of solution at a depth of 16 millimeters. The point of insertion for this block will be at the height of the maxillary mucobuccal fold, superior to the apex of the maxillary first premolar. We will be aspirating 2 times. For this specific injection, you will be administering 0.9 to 1.2 milliliters of solution, which will look like this. Be sure to thoroughly rinse your patient and dispose of the needle and cartridge in their respective bins. Let your patient know where they should be expecting numbness to occur. The postoperative instructions should be provided to the patient by the clinician. While numb, be careful not to bite your lip or cheek. No hot temperature food or beverages, no crunchy foods. Please stick to a soft food diet until the numbness wears off. Directly after depositing your solution, be sure to sit the patient upright and apply pressure to the infraorbital notch for roughly 2 minutes.